Hello, everyone. I'm Congresswoman Karen Bass from Los Angeles, California. I want to welcome everyone who's joining us online today. I hope that everyone is well. I hope you're safe at home. I hope you are observing all of the recommendations and you're practicing social distancing, but that you're not isolating yourself. You're finding new ways to stay connected to each other. I know these aren't the circumstances under which any of us would prefer to meet, but it's so important to be here together to celebrate our courageous first responders and, above all, to rally the country, to get them the critical supplies and support that they need to do their job to save lives and to lift our country out of this moment. I want to thank our first responders who will be joining us. I want to thank you for your service. And let me apologize to those first responders who are risking their lives because they don't have adequate protective equipment. This should have never happened. There is no excuse for this lack of leadership from the White House. I want you to know that I spent several years working as a physician assistant in one of the nation's largest trauma centers in Los Angeles. I worked in the trauma center at the beginning of the AIDS epidemic. I remember working without protection, and I remember the fear I had every day. I know the commitment you have to save lives, even if it means putting your own life at risk. The nation thanks you for your service. I also remember when the Ebola crisis hit. I remember how President Obama and Vice President Biden rallied the entire world because they understood what a pandemic was. The World Health Organization during that time predicted that 1 million people would die. Now, one person dying is too much, but 11,000 people died because the vice president, the leadership, the knowledge that the international leaders have of him and his relationship, they were able to mobilize the world. There was one death in the United States. I could go on and on talking about how many reasons and how many ways I believe he is an outstanding leader, and I'm so proud to support him right now. I only wish that he was in the White House today. Please join me in welcoming Vice President, soon to be President, Biden.
Thank you very much, Congresswoman Karen. You're a remarkable person, and thank you for actually, when we were thinking about doing this, it was your idea how to do this. So thank you very much. And first, let me start by saying how much I appreciate all of you taking the time out of the day to talk with me. You know, you're literally carrying the weight of the world on your shoulders, the first responders. Our people, our nation, we've always owed you. We've always thought that it was important that we recognize what you do every single day. You put in long hours. You are in a situation where you move very rapidly to try to help people. But the fact is, you lift people up, and when they're at their most vulnerable, and you fight like hell to protect the health and safety of your neighbors. That's always been true. But now, there's not a single person across this country who doesn't see exactly who you are and the heroes you are. Karen and I know because she was one during the crisis before, and I observed you all the time. But the average American doesn't know what you do every day, so I only have one message for you. Thank you. Thank you for who you are. Thank you for what you do. And thank you for your courage and your commitment helping other communities, everyone, all of us. And you don't ask, what community. You just go in and you do it. Thank you for being there for all of us when we need you the most. No, this isn't easy for any of you. It's quite frankly frightening. It's a little scary. I know there are doctors and nurses and EMTs and firefighters everywhere who are also making tough decisions about whether or not to isolate themselves from their families, who are paying out of their own pockets for hotels to try to keep their loved ones safe, who are struggling to figure out how to care for the kids who are out of school, their kids, who are also pulling long shifts in the ER, are staying on duty in the firehouse, running double shifts, and they're taking pay cuts in order to make sure the support staffs can still be on duty. And all of you are worried about maintaining your own health so you're able to care for others. But actually, heroic really doesn't cover it. And I know that's basically who you all are. Every time I thank a cop, a firefighter, a nurse, and I've been a great consumer of healthcare, say thank you. So it's my job. Well, it's so much more than your job, what you're doing. It's your part. It's part of your core to help. It's who you are. As I said, it's in your DNA. The rest of us know that we have to step up to as well. We have to have your backs by doing our part, by doing what we're doing here, by staying at home, by keeping our distance from other people, by washing our hands, by following all the CDC guidelines. I can't treat a coronavirus patient, but I can do what I'm supposed to do to make it less likely it spreads. I can stay home. I can make your job easier. I can follow the CDC rules. And you deserve to have the full support of our political leaders across the board. The House and the United States Senate have now passed a $2 trillion support package, providing critical relief for our people and some stability to our economic situation, including $100 billion for hard-hit hospitals and about $50 billion more to support public health and healthcare workers. That's critical support, and President Trump needs to make sure that we get that money out to you as quickly as possible. But we still need to do a lot more for our firefighters. You know, there's some money in the bill for equipment and supplies, but not as much as it should be for how much you're laying on the line. And I know that all of you are deeply concerned about whether or not you're going to have enough personal protective equipment to keep you safe while you're doing your job, whether you have enough ventilators to keep everyone who needs one, to help them, to save their lives. We owe you. We owe you that. Your government owes you that. And that's why myself and leaders all across the spectrum have repeatedly urged President Trump to use the Defense Production Act to get the PPE to everyone who needs it. We're already hearing terrible stories about doctors refusing and they're saying, I need help badly. And then going out and reusing some respirator masks over and over, storing them in paper bags in between patients. It's just not right. And apparently, the good news I just heard about 10 minutes ago, I say to the Congresswoman, is the president has just finally implemented the act, and he's ordered GM to make ventilators. That's a really good news. Now, we were suggesting you do that over a month ago. But the point is, he's done it, and I congratulate him for it. But now the president has used all the authorities available to help him make masks, gowns, and other PPE equipment available. And he has to do it today. On ventilators, they're reporting that the administration and the president were worried about buying or producing too many ventilators. If I can say, during World War II, there was not a concern about whether we had too many landing craft to liberate Europe. If we had them left over, that was fine. We didn't argue about, do we have too many? The question is, do we have enough? And you know better than me that's the wrong way to think about this. What do we need now? Let's not worry about too much. Too many is not a risk. Too few is a risk. So buy them, build them, and get them to the states now. And I know that you're all concerned that we still don't have enough tests, especially for those of you who are coming in direct contact with the virus on a daily basis. More tests are becoming available, but it's still not fast enough. And the only way we're going to get ahead of this disease is to find out where it is and where it's been. In recent days, there's been talk that we have to choose between public health and our economy. And so the president says, well, I don't think that's just a false choice. And it's a very dangerous way to state it. It would be catastrophic to reopen things around the country without a plan, and then have a spike in cases, shut it all back down again. To reopen, public health experts say we need first to bend that curve, deploy the widespread testing, have the ability to surge additional ventilators, protective gear to any new hospitals. That's the quickest, surest way of saving lives and getting our economy back on track. We need to make a significant investment in the people doing the work and saving lives to get our nation back on track. And I know we will. I know we will. Because of you, I know we're going to get through this. You're the best America has to offer. You're the folks who run toward danger, not away from it. You're the ones who we look to for help. And I couldn't be more proud of everything you're doing. So I want to hear from you now about what's on your minds and what you're looking forward to discussing and what you most need. But God bless you all. God bless you for what you're doing. I really mean it. It makes me proud to be an American watching what you all do in the face of this catastrophe we're facing. So I want to open it up, and Karen, it's all yours, however you want to proceed.
All right. Thank you so much. Our first question tonight comes from Dennis Lawson from Washington State. Dennis is a battalion chief and represents the chief bargaining unit for Central Pierce Fight and Rescue. Dennis, we'd love to hear your question.
Thank you, Congresswoman. Vice President, Mr. Vice President Biden, my name is Dennis Lawson, as you've heard. I am the president of the Washington State Council of Firefighters, representing 9,000 union firefighters here in the state of Washington. It is an honor to be part of this town hall meeting, and I'm grateful for the opportunity to talk to you about what's important to our members. Sadly, 4 weeks ago, we had the first American death, and that occurred in Kirkland, Washington. At that time, our responders made a choices to go in there and provide the services that they were able to do. Shortly after that death, we were notified that we had firefighters, paramedics, and EMTs placed in quarantine. Now, I'm not sure if everybody knew what quarantine or isolation actually meant back 4 weeks ago, but I think we've learned it now across our country. These firefighters were placed in quarantine where some were away from their families, they were locked in fire stations, and many of them were actually looked upon maybe a little bit differently by those even though he worked with. We had wonderful stories about people and neighbors trying to rally around. But we also had some personal stories that were very touching. We had a firefighter, third day on the job, firefighter Carlos Taldano from Kirkland Fire. Now, we've assured him that this is not the normal. This is not what's going to be expected in his course of his career. Now, I've been on the job for 33 years. I've seen a lot of things, but I've never seen anything like this before. I hope I never see it again. I'm grateful for our International Association of Firefighters, the leadership they've taken place and what they've done. When we worked out with our Kirkland firefighters and we were working through the quarantine and the isolation process, sadly, we also had a firefighter who was away from his wife who was going to give birth to a child. And the news that he got is that his wife delivered a baby boy named Hudson. And this firefighter, their wife Amanda, had a baby boy while he was in isolation. And people need to understand, this is real. This affects us across the country. And I know there's different ways of doing business, but let me tell you, Mr. Vice President, and you know this better than most, the men and women of RIFF and our profession, firefighters, paramedics, and EMTs, we love our job. We love what we do. We love serving our communities. We want to make a difference. And the issue of PPE, personal protective equipment, continues to come up. So my question to you, Mr. Vice President, what would you do to make sure that your firefighters, paramedics, and EMTs have the necessary and appropriate personal protective equipment to perform the work that their citizens have asked us to do? Thank you, sir.
Well, first of all, thanks for all you do. You guys are incredible. And you're the only folks. I grew up in a neighborhood in Claymont where you either became a firefighter, a cop, or a priest. I wasn't qualified to do any one of them. But a lot of my buddies, you're the same people who would, when you were kids in high school, you'd run to help somebody getting 10 guys on one guy, you'd run to help the one guy getting beat up. So it's not what you do, it's who you are. You're an amazing group of women and men. And look, one of the things that, I don't want to, I want to encourage the president to continue to do what he's begun to do. But, the first case in Washington State was confirmed back on January 21st. There were those of us in the 27th, I was writing articles for national press saying, we've got to move on this. This is important because we had the experience of going through something like this, not the same, but the Ebola virus, the Ebola pandemic worldwide earlier. And you can't move too quickly. It's only if you move too slowly. And so we've been really slow getting off of off the track here. I mean, it's just been too slow. And now in Washington State, I brief every morning with a group of docs that I have work with me. There are 3,207 confirmed cases as of this morning, and 46,308 tests have been taken so far. And there's 147 deaths, and hospitalization data, though, is not available up there. So the point is that you've been an epicenter for a while. I've been talking to your governor today. I've been talking to him. I think he's doing one hell of a job. But here's the deal. I think it's really important that we understand not only the protective equipment you need, because that's about mobilizing the industrial community through this act that the president has available to him to say, stop making cars, make ventilators. Stop making this, make masks. Stop doing that, make that. He's been reluctant to do that, when I still don't quite understand why. He says he is a wartime president, but he's not acting like a wartime president. This is a war against this virus. And so here's the point, that one of the things we don't talk about, Dennis, is that there's an awful lot of EMTs, there's an awful lot of firefighters, there's an awful lot of nurses and docs who are also having serious problems in terms of their anxiety and working deal through the equivalent of post-traumatic stress. And we need to also help there. There's nationwide, you got 2,000 firefighters who are dealing with this problem. There is nothing, the point I want to make, and I know this may seem inappropriate, but I want to make, there's not a single bit of difference between mental and physical illness. None. Zero. It's an illness. It's an illness. And they're able to be treated. That's why we pushed so hard in the legislation we had for healthcare that they be parity. Insurance companies have to pay for both. We need to, when you see that firefighter, you can see the stress. It's not about his or her bravery. It's not about his or her courage. It's about the impact on them in terms of how it's changed the way they think about things. And they need help. And you should encourage them. And I encourage every firefighter, nurse, doc who's going through this to seek the help you need, number one. Number two, I think what's going to happen now, Dennis, is that the legislation that Karen and her colleagues passed and the Senate passed has a lot of really good things in it. But I know from given the responsibility of handling the Recovery Act, it was called, the economic crisis in our administration, it was $900 billion. It's all about management and execution. How do we now get these things done? How do we get the money out the door for not only the equipment that is needed, but get the money out the door to keep people from having to lose everything they own? To be able to make sure they get a paycheck, to make sure they can buy the prescription, get the prescription, make sure they can do whatever it needs economically. And that really requires a place for all of you to go, all Americans and small businesses to know where they go to get the information. For example, unemployment. I was talking to your governor and other governors about this. The unemployment situation is now the House and Senate did a good job in making sure that we plussed up unemployment benefits, add $600 to whatever the normal payment would be, making you whole up to $75,000, et cetera. But there's not enough people in the unemployment offices around the country in order to be able to manage them. So what I'm worried about is 2 weeks, 3 weeks, 4 weeks down the road, people are still going to be struggling, not getting answers. So the president should be setting up, the White House setting up, letting everybody know in public service announcements, this is the number you call. This is where you go to find out how things are going to get done. And it really matters, again, in terms of how people think about this. People want to believe. The American people are brave, they're strong, they're courageous, they're willing to do whatever needs to be done. But when we tell them, now you have this unemployment insurance, now you have the money to keep small businesses open, now you're going to get the equipment you need to keep you safe, the PPE, and it doesn't happen, then they begin to wonder, whoa, wait a minute, what's going on? So it's about management now, management. And I think that's really, really important. What we talked about a while ago, literally several months ago, was the need to front end push all of this material that we needed. For example, we should be engaging the military, the United States military more. I noticed that the Pentagon, the chairman of the Joint Chiefs, talked about asking retired military personnel who were engaged in having done health issues, whether they were doctors, nurses, or any other function in the United States military. And thousands have said, yeah, count me in. They're retired. So the question is implementing this. We talked about this before, making sure that there's enough beds available, not just are there, and the military has the capacity to put those hospital beds in places that in fact can be used immediately. And you know where it's going to be. You know where things are surging. Look what's happening in Louisiana. Look what's happening in New Jersey. It's not like you have to be a seer to know where it's going to happen. And so there's a lot of things, Dennis, we can do. I'm hopeful that the administration is going to have really good management folks in place to implement what has been passed. But we have to move on it quickly. And again, remember, look out for those women and guys you work with who, in fact, are just a little concerned. You worry a little bit about their state of their emotional state, because it's normal. It's normal, and we got to get them help too.
Thank you very much, Mr. Vice President. And Dennis is also, I didn't mention earlier, he's the president of the chapter of the International Association of Firefighters for the state of Washington.
I know.
Our next question is from Michelle Thoman from Ohio. Michelle works as a nurse at the University of Cincinnati Medical Center on the ear, nose, and throat floor and the specialty surgery floor. We'd love to hear your question. Michelle is also represents approximately 1,700 registered nurses as the president of the RNA, a local union of the Ohio Nurses Association. We'd love to hear your question, Michelle.
Thank you very much, Congresswoman Bass, and thank you, Mr. Vice President, for allowing us this opportunity to speak with you. As Congresswoman said, I am the president of my local nurses union, which is affiliated with the Ohio Nurses Association and the American Federation of Teachers. Dennis spoke a lot about the critical PPE shortages, and Ohio nurses are facing those same perils, including the lowering of standards from the CDC to help conserve our PPE. These perils can't be understated. We continue to come into work because we know that our patients' lives depend on us being there. And when we're exposed, we're pulled off of our staffing rotations. There are hospitals in Ohio, including my own, that are forcing nurses when we're furloughed to rely on our own PTO or wade into the sea of red tape of workers' comp and short-term disability during this global pandemic. Many nurses really feel like we have no assurances that we'll be safe when we go to work. And on top of this, we're facing economic insecurities due to possible workplace exposures. I would like to share with you that this afternoon, I was actually mandated off of work on a 7-day quarantine and mandated to be tested due to a possible workplace exposure and development of symptoms. So my question, Vice President Biden, is when nurses are being placed off of work and having to run out of our PTO and are not being paid, and we start defaulting on our mortgages and are unable to afford groceries or our student loan payments, what should the government do to help them?
Well, first of all, I'm sorry for your situation. There's a lot of nurses and docs and others are going to be in your situation in terms of exposure. That's what I meant about risk. And I know it's a hell of a burden. And in addition to that, by the way, I've been a great consumer of healthcare because of the things that have happened in my family. And I want to tell you, and I'm not being solicitous, if there's any angels in heaven, they're male and female nurses. Docs let us live, but not a joke. You make us want to live. That's not a joke. I watched my son dying for 15 months. I watched the nurses. I was in ICU for a long time. I watched them and watched how they took care of my boys, and my wife and daughter were killed. You're incredible. You're absolutely incredible. And you deserve, at a minimum, what you give to everybody else. So let me start off by saying that one of the things that the emergency paid leave that was passed applies to everyone on top of your current paid leave. It would cover 14 days of paid leave or the duration of the quarantine that you're quarantined. So if you'd never have to worry about running out of paid time off or because you're sick or because you're exposed to the virus. That's what I meant about the management of this legislation that passed now. How do we let you know? How does the government let you know how you get it? When's the check get mailed to you? And will it get mailed to you on time? And there's not a single person across the country who doesn't see exactly what you're doing and who you are. Now Congress has taken some important steps. I'm going to read off a couple of them here. And there's good things in this relief bill. For example, $1,200 per person in direct cash payments. It's supposed to go out to every person in the country. child care assistance for essential workers like you, mortgage payment postponements for anyone who is financially impacted by the crisis. That's what has been passed. Now it has to be implemented. So I don't think if you have any difficulty, not a joke, anybody moving on your mortgage or any of that, pick up the phone and call me. They'll let you know how to get through. No, I really mean this. Not a joke.
I will.
Not a
Absolutely, I
joke.
will.
Because it's about how we get the money and make sure it's there. You're entitled to it now. Every American's entitled to this. But there's a lot more. For example, I think there's more we're going to have to do as we go down the line here. But we're going to, for example, additional checks to families should be conditions should be required. But I think there's a minimum of. Anyway, I won't go into all that. Let me just deal with your specific. You should have never been put in this position in the first place. You should have had the equipment, number one. Now that you have been put in this equipment, we should at minimum take care of the financial burdens that are imposed on you as a consequence of what you're doing, what you've done for others, and what needs to be done. So I promise you, that was the commitment the legislation made. That's the commitment you'll get. And if you don't get it, you let me know and let any of the nurses. By the AFT is a great outfit that you all belong to. You represent thousands and thousands of people who are out there every day. And so I've been working with your national president as well to make sure that everybody understands that you are entitled. Entitled. It's not a gift. You're entitled to what has just been passed. And that, again, $1,200. Do you have children?
I do not.
Okay.
No.
Well, you get $1,200 direct cash payment and mortgage payment or rental postponement as long as you need in order to get the money you need to be able to do that.
Great. Thank you.
Does that help to answer the question?
I think so. Do you have any thoughts on student loans?
Yes.
For nurses?
One of the things that I proposed, and I think we're going to have to come back, that's what I started to say, but I didn't want to take up your time, is that I think there's two things that we should be doing now. And that is that I think we're going to have a second round of these checks going to people individually 6-8 weeks from now. And secondly, I propose that there are a minimum of $10,000 forgiveness per person for student loan debt, because we're putting you behind an 8-ball in a way that is just hard to overcome. As a millennial, you've just been burdened with all of this, having to deal with the economic crisis that occurred to begin with back in '08, and then watching everybody get put behind the 8-ball. And so I propose that, and it's a proposal that's been put forward by Senator Warren and her colleagues, which I strongly support. And we need to have additional fiscal relief to states so their workers and communities can get the help they need. So the states, there's a thing that I know I'm going to sound like a wonk here, but the federal budget can run in a deficit in order to be able to deal with emergencies like this, like war and pandemics and the like. But the states can't have a deficit. So what's happening is now that taxes have been postponed to be collected until the summer, a lot of states have their tax revenue come off of the federal revenue and when that's filed and the like. And so everything's going to be backed up. States are going to be in trouble. And so that's why we got to rush this money to the states so they can maintain the commitments they've made in order to deal with the virus as well as in order to deal with the economic needs you have.
Thank you, Mr. Vice President. Our next question comes from Angela Pinnell. She is one of the viewers watching us live. Angela Pinnell McDermott. She wants to know, how can we get ventilators?
Well, the way we can get ventilators, and we're going to get them now apparently, is the way you get them is you got to produce them. And there's three things, or get them from other venues like some of the military facilities we have that they have more than they need right now. They'd have to be replaced. But what's happening now is the president has finally done what some of us have recommended for some time. He's gone to General Motors and say, stop making automobiles and make ventilators. You have the capacity to make the ventilators. And, you have the governor of New York talking about the need for 30,000 ventilators, and the president saying, but there's an overwhelming need, and the need's going to increase before it gets reduced. That's the way to do it as rapidly as we can, and then get them. Here's the other part. It's how you manage getting the produced ventilators to the places that are needed. They should go based on where the greatest need is. But in addition to that, I think we should also be having the military and the National Guard building hospital tents and hospital facilities, whether they're in hotels or in convention centers, wherever they are, because you know the hospitals are running out of room. They're running out of ICU units. And if you live in a rural area, there's not that many ICU units to begin with. So we've got to be building these ICU units, and they have to be done quickly, and they have to be done, and they can be done by the military.
Thank you very much. Our next question is from Tony White. Tony White is a emergency medical technician in Washington, D.C. He is a member of the International Association of Firefighters.
Thank you,
White?
Congresswoman.
Hey, Tony.
Vice President Biden, first off, I just want to thank you for taking this time out of your busy schedule to sit down and talk with us. It's really greatly appreciated. Just to introduce myself, my name is Tony White. I am a DC resident, born and raised. I am a husband and a father of 3 unbelievable children, ages 3, 8, and 14. For the last 12 years, I've been a DC firefighter and a member of IFF Local 36. I just want to give you a sample of exactly how it is at the front line for the first responders here in DC. DC is a densely populated city, as you know. And because of that, the calls that we run, we are definitely going to come in contact with individuals who are exposed or who will ultimately become positive. And we usually don't really know that until we're in the patient's home, talking to them face to face, and they're letting us know the symptoms they're having, or their loved one just traveled overseas in the last 2 weeks. And that's when the mental burden kicks in.
Yep.
Right. Our leadership has done a great job in preparing us to let us know what exactly to do in these situations, but that really does not relieve the mental stress. Once that one exposure runs risk for the whole department, because I most likely will take that exposure back to my firehouse, where there are 4 to 13 other individuals, and possibly expose them. Right now in DC, we have approximately 120 members being quarantined for possible exposure, and 12 members have tested positive for COVID-19. Additionally, we all have families. So if I'm being quarantined, then I am possibly exposing my family members to this, because not everyone has the resources to put themselves up in a hotel or stay away from their families. Now, Vice President, we absolutely understand the inherent risk that comes with our jobs, and we do it gladly. We run to the front lines every time, doing what we have to do, what we've signed up to do. But I think it would give us peace to know that if something were to happen to us, that we would be taken care of equally. So that leads into my question. What is your opinion on prioritizing testing for first responders who have been exposed to COVID-19, so that we can get back out into the field doing our job, but also to give ourselves a peace of mind that we are not exposing our loved ones and, the citizens that we serve to this virus?
Well, first of all, to state the obvious, Tony, thank you, pal. And, I've had this discussion with the president of your international and the vice president as well. And here's the deal. The fact that you're going without having access to the tests immediately seems to me to be absolutely not only unfair, but it makes no sense for the public health overall. And so we've seen stories like you of first responders being quarantined rather than being tested. You should be able to get the test right away. Right now, we're rationing these tests. There should be a priority for it. The priority should go to you all, nurses, docs, the first responders. They're the ones who should be able to get the test and get them right away. Now, we don't have enough tests for everyone who needs them, but Many doctors are being told to test people aren't severely ill because there isn't enough not to test because there isn't enough capacity. As a result, we don't know how many people are really infected. And the United States is in the middle of a major healthcare crisis. To state the obvious, we should be able to get people tested they need and take care of the men and women on the front lines to know whether or not you should be able to go back out or you have to be quarantined. And I think the CDC must draw on the advice from outside scientists and clarify the criteria for testing. It includes prioritizing first responders. That's the first deal, healthcare workers, so that you can return to addressing the needs. You know what every morning I spend between 40 minutes and an hour on the phone with a group of leading experts, former heads of the CDC and the real serious experts. And what they worry the most is that there's not going to be enough docs and nurses and first responders be able to respond. And so that's where the priority should go. It should go to the first responders, from the doc working with the patient to the nurse to all of you. And to me, it's sidelining nurses and first responders is just, to me, is bad for everybody. And so the number one priority should be to go to first responders and healthcare workers, period. Everything flows from that. But that takes me back to why we don't have more of these tests already. What are we doing? Why is it taking so long? What have we not done that we could have done? And rather than talk about what we could have done, just look back at what we didn't do and figure, okay, we're not going to do that again. We're going to get it right now. And there's been a real reluctance to, to level with the American people exactly what we didn't do. Because if you say we didn't do or what we're going to do now, without saying what we didn't do, they're going to say, well, why didn't you do it before? Well, let's just get it done. I'm not looking for anybody to take political hit or blame. Let's just get it right. And it's important you're healthy, Tony. It's important you're healthy, and all your colleagues are, in order to save my family and other families like mine.
Thank you. Well, our final question is from Trung Lee, who is calling in from Connecticut. Trung Lee is a registered nurse at the University Health Center and attends graduate school for adult gerontology and primary care advanced practice nursing. Trung, we'd love to hear your question.
Thank you, Senator. Thank you for having me, Vice President Biden.
Thank you,
I appreciate
Trung.
your time. So, like the Senator said, I am a nurse. I have a background in biochemical and cellular research and have switched careers to nursing. I have over 10 years experience. I used to be an ICU nurse and currently work on a step-down unit. My wife is also a nurse and she works in the ICU. So between the two of us, we see plenty of rule out and positive COVID patients. And I'm pursuing my degree in advanced practice nurse in the gerontology field. And I currently have 4 children and 2 stepchildren. So I'm busy, especially with school being out. But an issue that we have is because my wife and I are both nurses on the front lines, our hospital, we're needed there. And with childcare, you know, we're kind of waiting for that hit, that big hit to come. New York is getting hit now, and it's starting to filter up in Connecticut. At my hospital, the rate of infection is growing exponentially, and we expect within the next week, the New York population will hit our hospital. So when the hospital starts to mandate us, and we're both having to be at the hospital, you know, we worry who's going to take care of our children. We can't drop them off at grandma because of she's at high risk, and other brothers and sisters have their own children to take care of, and so you know, we're kind of in a bind. You know, what's the hospital going to do to our jobs if we don't show up for work because one of us has to stay home and watch the children? But leading into my question, you know, this pandemic has many consequences, many known and unknown. As a healthcare worker on the front lines, we're facing this crisis in real time, and like our vets, you know, PTSD is real. And you had touched upon this in your first question, in that a lot of times we deal with the patients, we face death, and we're just told to pick up and move on to the next patient, and without any debriefing or anything like that. So what are your thoughts about the mental health of our healthcare workers and frontline responders and doctors, nurses, EMTs? What are your thoughts on the briefing protocols, and what problems and possible solutions do you foresee in this foreseeable future post COVID-19 for our mental well-being?
Well, first of all, thank you, and I can appreciate the difficulty. Both you and your wife are expected in the hospital, and you're there. And how many children do you have?
I have 6, 4 biological and 2 stepchildren.
God love you. God love you. Well, look, number one, it is frightening, and for too long, too many professions, I should say, have thought that mental health was less important than physical health, and they're not distinguishable in my view. And especially with docs and nurses and first responders, you're all kind of trained. You're not going to show any weakness. And somehow you think if someone is suffering from PTSD or having mental health and anxiety problems, that is somehow you're not supposed to let anybody know, even though you're professionals. The truth is we have to provide more mental health facilities and capacity for all of you that in fact need it. And it should be funded, and it should be funded now and paid for, and it will be paid for. But the point is, first of all, we got to get over the stigma of saying, hey, I need help, number one. Number two, if you think about, the truth is we're facing 2 crises. One is the public health crisis, and the other is the economic crisis. You referenced the economic crisis. If in fact one of you will have to stay home and take care of the kids, then you may lose your job or lose your pay at the hospital you work at, number one. And number two, they will lose a significant resource. So one of the things that should be paid for, and we should make it permanent, by the way, is for paid leave and child health care, to take child care. Now, the hard part is getting the child care now. So if in fact you have to get home, one of you, it should be, they passed paid leave. You would get paid for being home if you have to be home for a reason relating to, in this case, a crisis, and your children need the supervision and someone has to be home. And so again, that's a matter of how in fact they implement the legislation that just got passed. That paid leave is part of that. And also, it's especially important that we make sure that, as I said, the mental health facilities, we should be providing significantly more help, and it hasn't been there now yet, for mental health, so that you have a place to go within your own hospital to seek the kind of assistance that you need from professionals, from professional mental health personnel, to be able to get the kind of help that you need. And it's overwhelming the interest, and you should not be in a position to have to pay for that mental health. You need to be able to be covered and make sure it is covered. So look, we worked really hard in our administration to try to make parity between mental health and physical health, because to me, there's no distinction. It is an illness, whether it's an illness of the brain or an illness, you break your arm. It doesn't matter. Your emotional system has great consequences under significant pressure. And so, but beyond all that, what we have to do is make sure that you're covered across the board in terms of the costs that relate to the work you're doing, and if you can't do it, how you get paid, you're going to get paid anyway. And whatever additional outside help you need, if you can find it and able to do it under the CDC guidelines, that in fact you're able to get it and it gets paid for. And it relates to to childcare. And so, and it's going to be, look, the other thing I know you know, Doc, because you're a really well-educated man, you know that there's a lot of going to flow from what happens as we finally beat this whole epidemic. And we're going to beat it, but it's going to take a while. And what's going to happen is there's going to be a lot of, how can I say it, a lot of scars left along the way. Just with, for example, single moms having to stay home with 4 kids and be essentially quarantined for, essential quarantining, other than being able to go out for a walk for a long, long time. It's hard. It's really hard stuff. Like, for example, anyway, I have a son-in-law who is one of the leading reconstructive plastic surgeons in the Philadelphia area, one of the major hospitals, and rated as one of the best. And he's telling me, we talk every day, and he's part of this group as well. And what's going on in the hospitals, what all the other things that have to be delayed, the operations that can't take place, that aren't available to take place, that are allegedly selective. But look at all the people. Like, for example, my wife and I worked very hard on this cancer initiative, the moonshot we had. And then the Biden Cancer Initiative that had 21 heads of the major cancer hospitals and about, I think it's 13 Nobel laureates. Well, we got a call from one of the folks on our board saying that, look, we got a lot of cancer patients at home who are scared to death. They're elderly. They don't know how to get whether they're going to be able to get their treatments, whether they're going to be able. And so we're starting a program, Jill's starting a program, and just picking up the phone and calling people and saying, tell me what your problem, okay, and just going by, stand outside a window and saying, hi, it's going to be okay, let people know. But there are all these ancillary issues that relate to being not able to get the normal access to health care that is people expect, and particularly people who are suffering from a disease that requires some constant care and attention. Afraid to go into the hospitals because what happens if I go in? Am I exposed now that my immune system is compromised? And so there's a whole lot. We should be making sure that were I in office, I would have my Surgeon General and/or the head of the CDC every day going out and as assistants talking on the air, reassuring people of what is coming, what needs to be done, what we are doing, why not to worry, what to worry about, just leveling with people, leveling with them. But in terms of your ability to, if one of you has to stay home, you are going to be covered by that. And everybody's going to get a $1,200 payment period under 75 grand. And that should be mailed out quickly. That can help in a lot of other ways as well. So, but I wish I had a clear answer for you and exactly what I could guarantee. We'd be in a much better situation had we had all the protective gear, all the testing equipment that in fact we should have had, we lined up to get, and we never got. They never moved forward on it. And so, but again, doctor, thank you, and thank your wife. I'm sorry. But by the way, you know what I noticed? I noticed that docs are finally figuring out that nurses can do a whole hell of a lot more than they've been able to do. You guys are going to be doing cataract operations and a whole range of other things before it's all over. I'm telling you the truth.
They won't admit it, but yeah, I know.
No, it's coming. It's coming. And I think it's going to be, and there's a lot. The interesting thing about the United States is every crisis we ever faced, we've always come out stronger in the other end and learned our lessons from it. I hope to God we learned the lessons from the ill preparedness of this, for this one, which we should have seen, which some of us talked about early on, way back in January.
Exactly.
Did you have anything else you want to ask me or tell me?
Yeah, you had touched about in your talk earlier about our hospital now is having us reuse masks, put them in paper bags and tape them on the doors of the patients' rooms with our names on them. So, we're reaching in and out of a dirty bag and putting it on until we find out the patient's positive, which could be a week later. And my wife was at the hospital last night. She said, even though nothing went wrong, everyone's wearing their mask, there was this underlying tone of dread that was unwritten. you can see it in everyone's faces, you can hear it in their voices, but we put on our straight faces and plunge forward. But I don't know
Doc,
what to say about that.
well, what's happening is that we've got this idea of everything's going to be okay tomorrow. The rate of these cases are doubling every day. We are now surpassed China in terms of the number of cases. I mean, so we just have to level with them, be honest with people, be honest with them. And as you well know, doctor, I'm sorry to demote you here. I'm
Okay.
joking. As you well know, Trung, we're in a situation where I think it's really important that people understand that there is a great deal that can be done, but it can't be done until things aren't going to change significantly, until that curve begins to level off, and we're, instead of having this upward trajectory of cases and deaths. And we know, for example, now where the new epicenters are going to occur. One's occurring in Louisiana right now, New Jersey. We see, I mean, it's not, you don't have to be a soothsayer to figure it out. And we should be rushing material there, from everything from IC units to hospital beds to equipment. And again, a lot of it has to do with what the president, thankfully, has now acknowledged and taken the wartime powers he had to be able to insist that a corporation stop doing something they were doing and go ahead and do something that's needed badly, like supplying respirators.
Thank you, Vice President.
Well, thank you. Come on, God love you.
Thank you. Well, let me just thank all of our first responders again for what you do on a daily basis, saving lives, risking your own lives, and protecting the American people. And I just want to say, as a member of Congress, I'm going to do everything I can to make sure, because I know we're going to have another package, and to make sure that we are able to provide for you adequately. I just have to say, Mr. Vice President, I know that if you were in charge today, you would have centralized the resources. All of these first responders would have had everything they needed, because you would have coordinated it. And I don't think anybody would ever question, when you got up to the microphone, that you would be speaking with the American people in your heart and not worried about your own self or your polling numbers. I also know that you would have brought the world leaders together to address the health crisis, but also the economic crisis that needs to be coordinated internationally. And all of those are the reasons why we need you to be the next commander-in-chief.
Well,
So
you give me a lot of credit that maybe I don't deserve, but I do think, Congresswoman, that there is an international component to this. You know, we just had the meeting of the G7 and the G20, and our Secretary of State insisted, and this broke the meeting up basically in terms of her influence, that this be called the Wuhan virus. And they're saying, whoa, wait a minute, let's not get into that now. Let's talk about what we need to do together. And people say, well, what are we going to do about what internationally is of any consequence? Well, it's a lot internationally of consequence. For example, the experts are already saying that once we get this under control, there's still going to be nations around the world that don't have it under control.
Right.
And so we're going to be in a position, we're going to have to make sure that travel to those countries to and from can occur. But we should be also figuring out how we get and rush to them, like we did in the Ebola crisis to Africa, how we keep it from spreading there, because it ultimately comes home.
Right.
We're doing ourselves a favor. But that doesn't seem to be the top of the list right now. But God willing, the president is going to come around on a lot of this stuff now that you've passed the package. But it really is going to all be about management. We're going to see about whether or not the administration knows how to manage what is difficult, I admit, but to manage all the help that you all have just voted. So, and look, I want to thank everybody for taking the time to log in today and join us. And I want to tell you all that to know that I'm here, the Congresswoman is here for all of you. If there's anything you need, any help we can get. If there's any message I want to get out to the American people, if there's anything more that we can do to support you and your families, you got to let us know. And this is one of the vehicles to do it. This pandemic lays bare how important it is that we have experienced leadership and listen to the experts, follow the science, and know how to manage crises. And right now, this in this moment is all about so much more than politics. It's about who we are as a people. And I've always said that it's never been a good bet to bet against the American people. There's nothing we can't do when we do it together. We work together. And we're going to come through this crisis just like we've come through every critical moment in our history. All across this country, Karen, I think you would agree with me, we're seeing people come together by staying apart. We're seeing people step up to help their neighbors. We're seeing all of you suit up every morning and every evening and keep fighting. And, you have the support and thanks of a grateful nation for what you've done. And thank you all for taking the time and for all the efforts that you're undergoing. And may God bless you all, because we need you badly. We need you badly. Thank you. And Karen, thank you so much. I appreciate it, Congresswoman.